I think of surgery as a weapon that can achieve many things. In early cancer, it can cure cancer. In middle stages, it can remove tumor to prolong life, but in later stages, when cancer is no longer curable, surgery remains a tool to provide palliation. I say in jest, but I am actually part-time surgeon and part-time enthusiast in surgical palliative care. I was dealing a lot with patients with advanced cancers, and many of them, despite the best surgery or the best chemo or radiation therapy, they still do have a shortened lifespan. And because of that, there was a need to improvise and to see how we can better cater to the needs of this patient. And surgical palliative care is essentially kind of trying to integrate the principles of palliative care into daily surgical practice. To be honest, palliative care can be applied at all advanced cancer stages. So it is very interesting because in the history of surgery, surgeons doing surgery to palliate patients was common. So when surgery first started in the 1800s, when you perform a surgery or an operation for a patient, it was actually to remove troublesome symptoms, that is to palliate them. The same surgeries that were used to palliate and relieve symptoms over time evolved to provide cure. So for example, in the past, if you had a patient with a breast tumor and then it was very smelly and it was fungating, causing the patients a lot of pain and symptoms, the surgeons in that era would remove the tumor through a surgery. And I think as we became more and more advanced, we realized that while we can also relieve symptoms, palliate them, we can also cure cancer through the same operation, and that was how surgery came about. And some would even say that palliation is at the root of surgery, and by practicing palliative care, we are merely going back to our roots. So I find it very meaningful in that sense.